This is an exciting topic. The idea of providing people with nurse concierge, advisor / navigator when people are trying to figure out a system which is what's not always that user friendly, both on the insurance side as well as the provider side. So
our mission at Concierge Nurse Navigators is achieving better health outcomes with emphasis on relationship.
My question to you all is, what happened to the American dream? Because the healthcare industry is really responsible for the largest legal wealth transfer in the past 30 or 40 years. They are truly the number one driver of poverty, homelessness, bankruptcy, and the opioid epidemic in America. In 2018, 70% of all bankruptcy in America was medical bill related, and 50% of those filed bankruptcy actually had health insurance in place, which to us says, they're either functionally uninsured or perhaps they just simply can't afford the cost of healthcare deductibles and premiums, co-payments, and prescription drugs. So we're here to help try to restore the American dream.
It's the first time in my career that I've seen us start going backwards on costs and up in care.
We ended up saving $2.4 million in healthcare spend. No transportation cuts were needed. No teachers lost their jobs. And that's the meaning and the impact of taking back over your own healthcare plan. Remove the traditional insurance carrier from your plan and go with an independent third-party administrator as soon as possible. You need to have the autonomy to decide and make your own decisions about your health plan. The very next piece is direct contracting. You want to find local direct primary care doctors if possible. You want to direct contract with labs, imaging centers, hospitals. You need to fire the Wall Street-owned pharmaceutical benefit manager and go with an independent, transparent PBM.
All the members need is someone to guide them to quality, cost-effective health care, and that's what I do.
Prescriptions are free. Your copay is waived. There's no deductible. I don't know why you wouldn't want to do something better for less money.
Pharmacy benefits are free for members when we have them fill generics at community-owned pharmacies because there's less misaligned incentives and more transparency.
I started noticing that I wasn't having to pay for medicines that I used to have to pay for thousands over the year.
Today,
I think that's key to this program, is having that person that can walk you through to take that burden off of our employees.
If I have a question, it gets answered almost immediately. That's immeasurable.
Having that person there to actually talk to you is huge.
How does it all work? So when we go out to our companies and we talk to memberships there and explain who we are and what we do, we start with this slide and we describe ourselves as the shepherd in the picture. So we ask them often, what do you see? And often you get responses, you see sheep, you see fog, you see the shepherd, you see the field. And then we ask, but what don't you see? And then we explain that in the distance, there's mountains, there's cliffs, could be predators up there. And it's our job as a nurse navigator to shepherd them, not only to what about what's right in front of them, but also to those dangers that are out there. And so we do that by, truly being a shepherd and being a support person. We guide them through all of the things that happen when they have a medical issue. What's best for the patient is what we're striving to do every single day. And we do that really by building relationships with people. What am I actually helping them with? And these are some of the ways that we help. Our members can call, text, email us, and they're going to get the same nurse every time. So I'm assigned to a company and a group of patients or members, and they're going to get the phone number to me. It's not going to go through a call center. It's not going to go through, they're not going to get a different person every time they call. And we start building a relationship that way. We know that not all physicians are created equal. Not all health systems are created equal. And so we have some tools and data that we can get into and really help to ensure that they have the best care and that they're going to the right places. and every day is a little bit different. Every relationship is a little different, but we build a relationship with them. Some people we're talking to, several times a week. Sometimes it's once, just once for the year, but it just really depends. But our entire focus is just really ensuring that those members know that we care about them and we have their best interest in mind. Happened recently where someone was diagnosed with breast cancer. We got her in. She's scheduled for her first session of chemotherapy. She calls me the day before and says they called me and said the insurance didn't approve the treatment, so I have to reschedule for 2 weeks from now. And she had emotionally prepared for her first chemotherapy treatment, had planned the travel, had planned the child care and everything. So we were able to get on the phone quickly and get her into the hospital that next morning at her scheduled time to have her first chemotherapy treatment, because it's just not okay. And it's really cool to have those tools to be able to do that and serve that patient in the way that we want. So that's a really, really cool part of my job. And we've seen some, just people, it transforms the way that they view healthcare and insurance and their employer, because it becomes it just takes down a lot of the barriers that are there and helps them to see things differently, because we're actually doing something for them and it didn't cost them anything. So that's really, really a neat thing for them.
Winning hearts and minds to positive change. I want you to understand that this does not work nearly as effectively, and it doesn't drive the outcomes if these folks do not trust you. So they've got to know, like, and trust and realize that these nurses are hired by their employer for them and their families. And so it's not insurance company, it's not the local hospital, it's really a concierge nurse to help protect, shepherd, and guide them. And so when we do the work, I just want to share with you that we're, delivering that American dream again, waiving $4,000, $5,000, or $6,000 deductibles so that cost is not an issue, and so that they get the care that they need. It drives better health outcomes. And in the end, when you're seeing the medical claims of these self-funded employers reduce 20, 30, sometimes 40% upon an engagement, that's when we know we're doing really good work that feels great when we lay our heads down. But ultimately, these folks embrace these nurses. I believe NPR had a podcast earlier this year, not on us, but on patient navigators, and how the state of Delaware adopted the same model, and they reduced cancer mortality rates exponentially, greater than I think any other state that's even attempted it. And it really came down to nurses and navigators who cared about the population that they were serving, to guide and shepherd and just protect them from harm's way, get the care that they need.
We spend a lot of time understanding the health plan design that each of our clients has. What they can do is call me and I can look at their documents and say, here, go to this urgent care center. You have this teledoc. Here's the phone number to teledoc that you can call. So that's a big part of what we do. Sometimes we're just helping them remember, or reminding them that they have these services available to us. So we can, create these great plan designs. But I'm sure if there are consultants on this call, you wonder why sometimes why there's an engagement in some of the programs that you offer. Well, kind of they forget and they don't remember that those benefits are available to them. So we help remind them that those are available to them and get them to teledoc or to some of the services that are already available to them.
The best example of advanced primary care, if some are unfamiliar, South Central Foundation, NUCA system of care in Alaska. Come on, this is the way medicine should be practiced all across the country, but we unfortunately the misaligned incentives prevent it. But it's a patient-centric care team. But man, does it mean more to those employees and families when they're getting free care, free access to a doctor, cell phone, being able to text, FaceTime, and certainly the nurse navigator who's there whenever they need them.